All right, everybody, we're going to get started. Just let me know if you cannot hear me in the chat. Sounds like we're good. All right, welcome everybody to the webinar. My name is Ashley Montroy. I am one of the UHKF board directors, new this year, coming up on my first full year with UHKF. I hope everyone is doing well today. Again, thank you for joining us. There are a few housekeeping items that we're going to go over just quickly before we jump into the webinar. First, this webinar is being recorded and will be available on our website and on YouTube as well. We expect the webinar to last about 45 minutes, and there will be time for questions at the end. However, if you do have questions throughout, just use the little Q&A feature built into the Zoom panel, and we will get to all the questions at the end of the webinar. You are here because you are among our most valued donors and volunteers, and we just want to thank you for your continued generosity. The Circle of Care events are held 3 times each year, and unfortunately for the last 2 years, we've had to hold them virtually, but we are hopeful that next time we'll be able to get together in person. The purpose of these Circle of Care events is to provide donors like you who are the champions or ambassadors who care annual giving level, who are at the champion or ambassador who care giving level, our monthly donors, and our evergreen members who have confirmed a legacy gift, a special opportunity to connect with some of our outstanding healthcare providers. We are very fortunate to have Dr. Adrian Baranchuk, head of the Heart Rhythm Service at KGH, with us today to talk about alcohol and cardiovascular health. Just want to say welcome, Dr. Baranchuk. There he is. He's going to take over.
Hello, good morning, everybody. And thanks for the kind introduction. I'm going to share my screen so you can see my presentation. Please let me know if you can see the screen properly. Can you see me?
I can.
Well, first of all, I would like to thank a lot the University Hospital Kingston Foundation for the amazing work you do with and for our community. And today I will bring you some ideas of why donations are good and in which sense donations also help us shaping our research profile and alternatives. So today I picked one of the lines of research of my lab, which is the relationship between alcohol and cardiovascular health. And I will try to share with you the things that we all should know and take into consideration when we decide to enjoy, for example, a glass of wine. And I'm going to show you then what are the potential benefits and what are the risks and restrictions that we recommend to everybody. As it has been said, there is a Q&A function, and if you want to insert your question about this or your doubts as you hear the presentation, please do so. And after listening to one of our donor and grateful patient, Ms. Nancy Cosgrove, I will be happy to entertain some questions and to do my best to provide you with some answers. So these are my conflict of interest and none of those grants that I have received from industry are impacting our research in the relationship between alcohol intake and cardiovascular health. And this is what I will try to cover, and I will try to do it attractive for you. So using the less technical language and to try to share with you some of the difficulties that we have encountered through our journey researching this and what is our future on this domain, so you understand how are we focusing our research. But before we start, I would like to make some clarifications because I'm going to base my presentation on the benefits for your cardiovascular health. But I want to be very clear and firm that alcohol is bad for your health. Yes, I know that I'm not making friends right now, but this is a fact. So if you don't drink, I don't want you to start drinking based on the potential benefits that I'm going to discuss today. Is that clear? So if you decided to have a drink, do not drive. I don't care on the amount, on the discussion with the police officer that is going to stop you and check your levels. If you have drink, don't drive. If you know that you will be drinking in a party, just organize transportation back, period. This is not for discussion. This is a mandate. When I go to a party, I don't enjoy a glass of alcohol if I have to drive back. If I'm gonna do it, I go by a cab. And if you drink a lot, you need to seek for help. And there's no labeling or stigmatization on this. If you're drinking a lot, your quality and quantity of life is being affected. So please seek for help. Having said all that, let's go to how alcohol and your cardiovascular system interacts. And this started about 5 years ago with a group of students. I've been able to publish this in Circulation for you to understand. This is one of the highest impact factor journals in cardiovascular health. And wine specifically, as you can see, has many components that impact your health, from ethanol to the famous phenols. And you will hear a lot the flavonoid and non-flavonoid components, some of them as resveratrol, with a huge positive impact in a dose-dependent manner. If you take little amounts a day, there is a very positive impact in your vessels, both in your veins and arteries, allowing the blood flow to increase and reducing the risk of getting blockages in your coronary arteries. But remember that ethanol, and I will put some emphasis on that, and the sugars also have deleterious effects in your cardiovascular system. The major sources of flavonoids can be found in red wine, in tea, in fruits and vegetables. So all these favorable substances that help your cardiovascular system are not only found in wine, but also in other things that you may consume every day. And the mechanism of action is to improve your lipid profile, reducing the clot formation in your vessels, and the inner layer of your vessels improves a lot. And I'm pretty sure that you have heard several times about antioxidant and anti-inflammatory properties of different substances. Well, wine, again, in a dose-dependent manner, when you take very little amounts, and I'm going to insist on that, it produces that positive effect of antioxidant and anti-inflammatory properties. And that decreases your cardiovascular mortality, decreases the progression of your atherosclerosis, which is the formation of clots in your vessels, and decreases also, as I said, the formation of clots in all your body. And that decreases the cardiovascular risk. And when we go into even more detail, and this figure was published in this paper, we're able to localize exactly which mechanism in which part of your body relates to a positive outcome, increasing dramatically the efficacy of your cardiovascular system. So this is something to take in mind, because if you are drinking within the guidelines for your cardiovascular health, there's no doubt that there are benefits. And of course, doctors usually try to arrive to guidelines where we can measure things in detail, and these conversions factors to understand how much of wine, how much of beer, and how much of spirits, as you will see later, has not convinced even doctors to learn it, to apply it to patients. So we had somehow to simplify the message. And one of the first things that I want to pass to you is all the beneficial substances are 10 times more concentrated in red wine than in white wine. This doesn't mean that you cannot have a glass of white wine, but if you decide to drink with moderation, please know that red wine brings more beneficial aspects to your cardiovascular health than the white wine. And this picture here is to show you what are the variations country to country or region to region in regards of how much we allow people to drink to be in the safe side. And you can see that Canada and the US are pretty much around the 14 grams. However, the UK recommends a much lower amount of ethanol drinking, while Australia is in the middle and Japan relaxes a lot. I don't want to see our potential donors at the Kingston Hospital Foundation going to live in Japan just to have a little bit more relaxed rules on how much alcohol you can drink. And the World Health Organization started to simplify the things, saying, okay, the quantitative metric that nobody can remember could be summarized as a 1 glass of wine or a small glass of sherry. For beer, 1 can of beer, and there is a trick here, we're talking the 355. Remember that beer industry designed larger cans of half a liter, that's 500 milliliters, rather than 355, for an increase in the price that is extremely little. So now we're drinking way more than what we should be drinking for almost the same price, and a shot of spirit. So when I refer to drink in moderation would be 2 glasses of wine a day for men, 1 glass a day for women. At the present time, I know I'm polarizing the audience and half of you are mad at me at the present time. But both of you, female and males, living 2 days of full abstinence. So when I see a patient that is drinking in this range, I suggest that these 2 days are weekdays. So if they are going to attend a party or they are going to socialize, they have the ability to use that 2 glasses a day in the weekend. Please note that these are not cumulative. So if you decided not to drink anything for 3 days, that extra day, you cannot add it up to the day that you're drinking. Otherwise, you alter your liver metabolism, okay? Part of the future of our research is we have invested the last 18 months doing an archaeological study, trying to determine why men and women should be drinking different doses to have benefit, given the fact that when we use drugs like an aspirin or an statin, the dose does not have gender adjustments. This is the only recommendation in medicine for a potential benefit in your cardiovascular profile that is segregated by gender. So this is work in progress. It has been submitted, it's been analyzed. So I don't want to do a spoiler, but maybe the foundation will invite me in 6 months or 12 months to release the results of the new research. And again, from the World Health Organization, they did this graphic that I found very easy to understand. 1 can of beer, 1 single shot, 1 glass. And believe me that I have patients in Kingston that come with a bag with a massive glass and says, when you say 1 glass, Dr. Baranchak, are you referring to this? Say, no, look at this picture. I'm referring to a restaurant glass. So don't amplify the volume to be drank based on the glass size. I'm going to go quicker with this, but this idea of the benefits and slow doses for the cardiovascular health is supported by research by others, not only mine, on almost 2 million people. And what is this thing of the resveratrol that you have heard several times? It's one of the components of wine that is very easy to digest, and it has a very strong antioxidant effect, increases the good aspect of your lipid profile, increases insulin sensitivity. So this amount of wine, it's also admissible for patients with diabetes. So and it is associated with an increase in the reduction of cardiovascular mortality. One could say, well, if it is so good, why don't we have it in pills and we can take it as a medication? Well, this slide is to show you that this is in the works. They want to extract resveratrol from wine and start testing it as a potential medication. There's more than 130 studies trying to prove that. I know that you have heard about the dealkalized wine. And this is interesting because the side effects over the central nervous system and on some of the increased cancer development, even by taking very little amounts of wine, are associated with the ethanol action. So you can remove with this system, we don't need to understand it, but you can remove all the ethanol from that, all right? And with that, you remove everything that is negative in wine. And in addition, look at this. If you check the calories that a regular glass of wine has, 125, in comparison to the alkalized wine that has only 30 calories, for each glass of regular wine, you could be taking 4 glasses of the alkalized wine to ingest the same amount of calories. This is why some people is going to parties with their own dealkalized wine. At a personal note, I tried it. I didn't like it, but flavors are very personal. So people may like it. And of course, if you decide to move to that, you are doing a big step towards a healthier consumption. Alcohol and atrial fibrillation. For those of you that do not remember what atrial fibrillation is, some of you may say, I know because I have it. It is, remember that the heart has 4 chambers and each contraction is composed by a bit of the upper chambers and a bit of the lower chambers. Please note that I can move my hands and talk at the same time, and that took me only 30 years of practice. But sometimes the upper chamber, rather than contracting, fibrillates. It's trembling there. And then the contraction of each bit is irregular, and that can produce formation of clots, and people is at a higher risk of stroke. Well, the point between alcohol intake and atrial fibrillation is that small doses of alcohol increase the risk of atrial fibrillation. However, look at that. This is the curve for mortality. As I told you before, if you drink within the guidelines, there is a decrease of mortality. And as soon as you start taking more, there is an increase in mortality, okay? With atrial fibrillation is the blue line, and you see that the risk goes from 1 in a logarithmic manner higher. However, when you cross the red arrow here, the increased risk is from 1 to 1.1. And then I would like to compare this to the risk of dying when you drive to Toronto or you drive to your cottage. It's not 0, guys. Once we hit the 401, there is immediately an increased risk of dying. So watch out when we say that something increased the risk of something. Yeah, it is true. A sip of wine increased the risk of atrial fibrillation. However, within the guidelines, that increment is something that you have to decide if you feel comfortable or not. And this is, again, a study on almost 250,000 people showing that the real problem between alcohol and atrial fibrillation starts when you're drinking high amounts of alcohol. And after our publication in Circulation, we had the opportunity, and we've been called by the Washington Post with a note on double page, by Time Magazine, to keep educating people in the relationship between alcohol and cardiovascular health. However, there was a demand for us to go a little bit deeper on the understanding of some chemical components of wine. So we kept publishing in this domain. I'm going to skip this just for the purpose of time. But the next 2 slides is to show you something that is of huge concern to us. Each cardiologist, each doctor knows what to recommend to patients in terms of salt consumption, on Mediterranean diet, what is healthy to eat or not. in how much exercise you have to do, in teaching patients that any dose of tobacco increases your cardiovascular mortality. However, when we check within doctors in different regions of the world, in this case in Argentina, which is a country that produces wine a lot, the level of knowledge of doctors on what to recommend to their patients was way less than optimal. And then we say, well, maybe this is something that happens in Argentina. So we repeated the same study in Uruguay, and we found exactly the same response. Doctors are not familiarized with the guidelines that I'm trying to teach today. And then we went to Europe, and we did it in Canary Island, and we found exactly the same response. So there is the need of permanently advancing knowledge in this topic, not only for the communities, but also for the medical body, because they need more education on what to tell to patients about this. And as I was telling you, this went to the British Medical Journal, to the Time Magazine, to the Washington Post, etc. I am arriving to the end of my presentation. I want to reinforce these 3 rules from the American Heart Association. As I said at the beginning, if you don't drink, I don't want you to start based on what you heard. If you drink in excess, you need to drink less, and this may require seeking for help. Speak to your family doctor. Nobody's going to stigmatize you. And if you drink within the light moderate, you can continue to do so if you live 2 days of full abstinence, and my recommendation is leave it during the weekdays. I would like, before giving passing the stage to my patient and now friend, Nancy Cosgrove, to think, and I take full responsibility for these 3 lines. This is representing Dr. Baranchak and only Dr. Baranchak. Why to donate? And when I become a donor, this is the way that I think on my donations. I think that donate is important because we can provide better care to our patients when we have higher technology, different technology, and we become more competitive in the type of care that we can provide to our community. To me, sending a patient to Toronto or Ottawa because I can't provide that service, it breaks my heart when I know that in our hospital foundation, there is the capacity to provide for this service if we have the proper sources. And something that sometimes we don't think when we donate, and this is independent to whom you decide to donate, is the ability to support research, to understand science better, to discover and to innovate in science, to be able to provide better care to our community and other communities around the world. I will be happy to take your questions. While Nancy is presenting, I will review the Q&A. Feel free to send us more questions. And now I am absolutely thrilled for the opportunity to present one of our grateful patients. This is the way that she wants to be recognized. She's more than that. She's an incredible individual that within her busy agenda, she always has in mind the needs of her community. So thank you very much, Nancy. Please unmute yourself, and I'm going to turn off my microphone and camera. You're still muted, Nancy.
Thank you.
Here you go.
There you go. Hello, my name is Nancy Cosgrove. I've been a patient of Dr. Baranchak since late 2018. I was so struck with the warmth and the excellent care and the compassion that Dr. Baranchak demonstrated when I was under his care. I'm feeling 100% better since my ablation, and I'll say a little bit about that, with no episodes of the arrhythmia that I developed in 2018. I'm so impressed, Dr. Baranchak, with your great knowledge. You spent hours and given so much of your time to make sure patients like me can live a normal life. And he always went out of his way to find answers in my treatment and always inspired great confidence. So I developed this arrhythmia in 2018. My heart would suddenly soar up to 200 beats per minute. I was sort of diagnosed in Florida during a particularly lengthy episode of tachycardia, which means a fast heart rate. So they ran a few very expensive tests in Florida, during which one machine broke down. And the results of the stress echo, which I had later, were deleted by the technician before she saved them. But I was charged $10,000 for each, despite the fact that there were no results given. They decided it was atrial fibrillation. It wasn't AFib, as the doctors in Kingston discovered subsequently. So when you have an arrhythmia, your world becomes a series of waiting for the next event you know will happen, but you don't know when. This uncertainty certainly gave me pause about planning events, trips, and just about anything that would be longer than a few days. Dr. Baranchuk discovered that my arrhythmia was actually an AVNRT, AV node reentrant tachycardia. Thank you, Dr. E+. So the tachycardia gave me great pause, of course, as I tried to plan my life around not knowing when it would hit. And I don't normally get stressed, and I'm a pretty positive person, but it was becoming worrisome as the episodes got more frequent. I did learn the triggers like fatigue, extraordinary stress, alcohol, thank you, Dr. A, and caffeine, and did my best to avoid them. Arrhythmias are pretty strange animals. In fact, one electrophysiologist calls them the perfect storm. It's the strangest sensation. You feel lightheaded and this weird feeling of impending doom. Your heart rate skyrockets and you wonder just how long your heart can manage 200 beats a minute. As the episodes became more frequent, I saw Dr. Baranchuk and he scheduled me for an ablation. The ablation itself is a minimally invasive procedure, but it's kind of miraculous because instantly your heart returns back to normal sinus rhythm. And I haven't had no episodes since my ablation in 2019. It's a very relaxing procedure. I was pretty calm through it all, and thank God for twilight meds, I guess. But yeah, it was, I felt very comfortable, very confident. Dr. Enriquez did the ablation, and it's just amazing. You can actually watch it on the screen. So it was quite an experience. And as I say, I haven't had any symptoms since. So I just want to say, as a grateful patient, you are so fortunate to be in Canada. You're so fortunate to live in Kingston with a world-class team of medical experts who really care about you as a person. The average hospital stay in Canada costs around $1,200 a day. In Florida, I was admitted to kind of a step-down unit, not an ICU, and I stayed 2 days. I was charged $100,000, despite the fact that I had purchased extra insurance just to cover any eventuality. Anyway, I'm just going to say, and I know you're donors and I know you're volunteers, but I say this to everyone I see at the hospital and to my friends and family. You know, if people appreciate the great care they receive, you've got to tell somebody, thank your caregivers. and put the University Hospital Kingston Foundation between your hydro bill and your rent check. And, you know, any amount is needed and so gratefully received. I just love the people at the foundation. They're amazing, amazing individuals, and they've got your best interests at heart. There are so many ways to pay it forward. Ask the volunteers. Some of them have been there as long as 20 years. I have never met a grumpy volunteer. They bring so much joy and cheer. And read the story about the Griffin family. So grateful for the care they got in the NICU at KGH, who volunteer as support workers to help new patients or new parents who have a baby in the NICU. Whether it's a cost of a coffee or a cost of a meal, it makes a huge difference, believe me. Thank you so much. And thank you for your presentation today, Adrian, and thanks for listening.
Thank you very much, Nancy. I hear talks 2 or 3 a day with this explosion of the virtual communication, and very rarely I get emotional. Thank you. I would like to go to the Q&A, and you may help me with one of these questions. So I will start with 3 wonderful questions from Ms. Himstra. She says, does organic wine have the same components? No, the components that are different in organic versus non-organic have to be with the preservation of alcohol. So, and this is why organic always tends to be healthier than non-organic, and that applies for multiple other components. For example, the grapes are not fumigated, etc., etc. In relationship to cardiovascular health, I can't answer that because I don't think there is enough research, but it's an interesting question. The second one from her as well is the alkalized beer of any benefit? And I would support the same note that I did for the alkalized wine. When you remove the ethanol from the drink, there's a substantial benefit because you're removing the negative aspects of the alcoholic drink. I have to be honest, I never tried the alkalized beer, so I cannot confirm on the flavor of that, at least from my own flavor. But if you do during our next encounter, please let us know if you found any difference. This one I answer. This is she says, this is very informative and useful. Could a similar presentation be made on the relationship between alcohol and cancer risk? Thank you. The answer is yes. So please, the foundation, take notes so we can identify a researcher working in this area. I'm pretty sure that the people from our outstanding, amazing oncology research team will be able to discuss on this topic. Remember that some of the benefits on the cardiovascular health system are not directly transposed to the risk of cancer. Ms. Webb is asking, and here you go, Nancy, is asking, what is an ablation? What does the procedure involve? Would you like to take on that one?
Oh, sure. Basically, they insert, you know, you've probably had, what do you call them? You know, the Preop. Oh, the name escapes me. But anyway, as I said, it was minimally invasive. They thread, I think it's 3 catheters, right? Through your femoral artery up to your heart. And one of them is a radio-controlled heat source, or is it?
Perfection. No, I was thinking in hiring you for my next talks because you are explaining this very technically and very well. So how long did it last, the procedure?
I think it was about 20 minutes.
And did you have to stay in hospital after the procedure?
No. Just stayed for maybe an hour or two and walked out.
And what was the recovery time at home? Because we use your right groin, as you said. It's the femoral vein, which is less risky than the artery. But how long it took you the recovery at home?
Oh, 2 days. I didn't feel anything. I didn't have any problem with the site of entry. I had no arrhythmias, and I was absolutely delighted.
All right. So I would summarize then more from the professional side of you told the experience as a patient. Basically, an ablation is an extremely safe procedure. Success rate, depending on your type of arrhythmia, higher than 90%, with some of them, like in the case of Nancy, higher than 97%. Complication rate less than 1%. So you use your right groin, we go up to your heart, we produce the arrhythmia. If you're a person that would not tolerate that, we can offer a general anesthetics. The procedure, she was very generous. She quoted 20 minutes. I'm going to defend Dr. Enriquez. I'm going to say an hour and 20 minutes.
Really?
Okay. Yeah.
Wow.
Well, so, because you were so comfortable that you went to sleep for part of your procedure. So you lost track of time. And as she said, a couple of hours of recovery in hospital, but it's a same day procedure. And it takes a day or two at home where we ask you not to do excessive exercise to allow the good healing in the side of the groin. And then we may do sometimes one more post-procedure checkup. Sometimes the things were so good that we send you directly to your family doctor. Thanks for helping me on answering this one, Nancy. This one comes from Ms. Webb. What's the difference between AFib and a functional heart murmur? So AFib is a rhythm disturbance. The problem of AFib is it can affect the pumping of the heart, or it can increase the risk of stroke depending on other clinical variables. A heart murmur is produced when the valves of the heart are not closing well, or they are a little bit stiff, so they are not opening well. So the blood flow through the valve produces that noise that we can hear with the stethoscope. So it's a different thing. One thing is a rhythm disturbance is in the electrical part of the heart. The murmur is in the valves, which are like the doors of the house. So those are two different issues. An anonymous attendee says, is weight a factor? My wife is half my weight. And I'm sad that this anonymous attendee is not given the full name, because this is a brilliant question. Thank you very much. This gender segregation that we are talking between men and women could be then associated with your weight, because in your case, your wife is half your weight. But I can show you several couples when women have same weight as men or have larger weight as men, and we're still indicating that they should drink half the amount. So if the situation is weight, we should stop this gender segregation. So your question is spot on. Part of that archaeological analysis that we've done revealed that you are right, that in the past 50, 60, 70 years ago, we assume women are half the size of men. So they deserve half of their rights and half of their pay. Now we have reviewed that, and you have lots of men like me advocating for gender equity as much as we can. Remember, as a cardiologist, I taught my students 15 years ago that women have less risk of developing heart disease. We were so wrong. Now we know they have the same risk. So when a woman feels chest pain, don't ignore that because, she's a woman. She may be a little bit too nervous. No, sir. Women have the same chest pain that men have and deserve equal treatment. I go to the next one. I love that topic, so I get a little bit passionate. Mr. Brooks says, I'm still confused. If there are cardiovascular benefits to red wine, what should I not start drinking a few glasses a week? Very nice. all the other risks counter the benefit. Brilliant, brilliant question, Adrian. We share the name and we share the interest on that. If alcohol was a substance with no side effects on a dose-dependent manner, definitely you could be right and say, hey, if for my heart this is good, why am I not going to start? For two reasons. One, as it is a dose-dependent, if you cross the threshold, you could be initiated in a, even if it's not an addiction, in a deleterious consumption of the substance for your cardiovascular health. Why? Because all the good things that I said, when you drink more, you have more hypertension, more intracranial bleeding, and more arrhythmias. So that compensates. As you start drinking more, first you compensate benefits and deficiencies, and then you overdrive that, and you have more deleterious effect than good things. That's one thing of why not to start. The second thing is alcohol is a recreational substance. It's not a medical substance. So our work was in going deeper in between the relationship of a recreational substance and your cardiovascular health, not to promote alcohol as a medical therapy. We don't want that. We don't want that. We want to alcohol stay where it is, which is a recreational substance that you decide to go or not. And you gave me energy to say two more things. If you are pregnant or planning, actively planning pregnancy, alcohol zero. Alcohol zero. You do not drink if you're planning to get pregnant or you are pregnant. Okay. He says, I drink maybe one beer every few weeks at the moment. Keep doing it. You enjoy it. Good for you. You are in the safe zone, Adrian. So you will try the de-alkalized version of it and see if you like it. Of course, because if you like it and you enjoy the flavor, of course you are in the safer zone going to de-alkalize alcohol. Thank you for your questions. So if there are no more questions, I could return to our hosts, Nancy. Before I let you go, I want to thank you for the opportunity to do this with you. It is a tremendous honor to me. I want to tell the audience that we created a relationship where when my daughter is performing in public, Nancy comes with her friends and supports the young artists. So her ability to donate is not only to donate money, but to donate love. Thank you very much.
Oh, sweet.
All right. On behalf of UHKF, thank you, Dr. Baranchuk and Nancy Cosgrove, for taking the time to join us today. Nancy didn't mention this, but she is also a UHKF donor. She and her husband were so appreciative of the care that Dr. Baranchuk provided, as you can tell, that they made an Honor Your Caregiver gift to thank him. You can learn more about the Honor Your Caregiver program on our website at uhkf.ca. It is an easy way to say thank you to an individual or team of caregivers. And I just want to say personally, thank you both. I was smiling watching Nancy talk about her story, and I can feel just how great you are with your patients, Dr. Baranchuk, by the things that you're saying. So it was really nice to sit back and watch you guys. Before we go today, everybody, just a reminder, this webinar recording will be available on our website, on the UHKF website, and on the UHKF YouTube channel if you want to watch it again or share with friends and family. Thank you all for attending today. As mentioned earlier, you are all donors at the Champion or Ambassador Who Care annual giving level, your monthly donors, or an evergreen member who has confirmed a legacy gift, or a volunteer. And we appreciate you and your continued support of our healthcare facilities in Kingston. If you would like to make a donation in appreciation of this presentation, text ICARE, I-C-A-R-E, to 20222. Again, ICARE to 20222 from your phone, and a $25 donation will automatically be applied to your phone bill. Please take a few moments as well to complete the survey that you will receive immediately following this webinar. And again, thank you all for joining us today. Hopefully we'll be able to see each other face to face in the not too distant future.
Okay, lovely. Thanks, Ashley.
Yes, absolutely. Thank you, Nancy.